Hi all, my name's Ronnie and my wife succumbed to endometrial cancer on the 12th of August on 2022, and not a day goes by that I don't miss her after 42 wonderful years together. Diane was diagnosed with endometrial cancer type 2, a clear cell type, in July 2021 after experiencing severe abdominal pain and bleeding from the vagina one afternoon on April 24th, 2021. A doctor, a female doctor, immediately referred her to a gynecologist in Geelong, who performed a D&C in June and sent samples away to get tested, saying that things looked okay, as she'd had regular tests in the past and all came back negative. A week later, we received a call to get a PET cervical CT scan, MRI and chest scan. She knew something was wrong. We were then referred to a wonderful gynecological oncologist in Francis Perry House in Melbourne in late July, who told us Diane had endometrial cancer type 2, clear cell cancer, at late stage 3. 3 days later, on the 2nd of August, she then had a radical hysterectomy and the lymph nodes were inspected and removed if necessary, and they were. 3 weeks later, we were referred to Epworth Freemasons Hospital to both the chemo and radiation oncologist who laid out what treatments were to come and the timetable for them. This was all in the midst of COVID pandemic, which I'll discuss later. The chemo and radiation treatments began the following week until the last chemo on the 3rd of January 2022, and then wait 6 months to rid the body of chemicals before the next consultation. In July 2022, we went for the consult with so much hope of good news. Unfortunately, it wasn't. The treatments hadn't worked to stop the cancer. In fact, it had exploded and spread throughout her body and metastatised to her liver, stomach and shoulder nodes. The second option was recommended, a new drug, but she advised it had really bad side effects and the success rate was not great, 5 to 20%. We then asked if we could get treated in Geelong as the travel was taking its toll on Diane. Fortunately, there was one who was recently positioned at Epworth Hospital in Geelong. We went to see her and she told us straight out what was involved with the new drug, and it was not nice, but Diane would need to build up her strength before we could begin, as she was pretty run down and weak at that stage. Diane then turned to me and just said, "I can't go through with this anymore. My body is telling me it's time to go." You can imagine what it was like for me. It knocked the bejesus out of me, but I had to respect her wishes and I didn't want her to suffer anymore. We both had a very deep emotional discussion on it. And as much as I didn't want to lose her, the decision was made. And then she went into palliative care and unfortunately passed away 4 weeks later.
Hello everyone, my name is Maureen O'Keefe and I was diagnosed with endometrial cancer in February 2018. The diagnosis came after 9 months of almost continual heavy bleeding and being told it was normal for perimenopause to have these symptoms, but I just knew it wasn't normal. On the day of diagnosis, I was told that the cancer had actually been growing for 18 months. My diagnosis was adenocarcinoma, grade 2, stage 3C. My treatment was based on the Portec 3 protocol and took place across the Royal Women's, Peter Mac and Andrew Love in Geelong. In November 2018, after a PET scan, I was told no evidence of disease, which was great news. I had regular checkups at each of the hospitals, and in September 2020, after my regular blood tests, I got a call from my oncologist in Geelong to say, something's not quite right, something off in the bloods, and I should have an urgent PET scan. The scan found a small tumour in my acromion bone, and yes, I had to look up where that was, but it's in my shoulder. Stereotactic radiation followed, and I was put on Provera, which I'm still taking 5 years later. I now have an annual CT scan as part of my regular monitoring. Engaging consumers with endometrial cancer is difficult because there's no advocacy group, particularly for endometrial cancer in Australia. The researchers reached out to Counterpart and the Cancer Council of Victoria to find consumers for focus group discussions, and also ran a survey on an Australian endometrial cancer Facebook support group. We will be representing some of those voices of consumers today who participated in the survey and the focus group, as well as our own experiences.
Until Diane was diagnosed with endometrial cancer, neither of us had ever heard of it, or what the symptoms were, or what could lead to it. We hadn't heard of gynecological cancers other than cervical. None of this information is put out there, like the mainstream cancers such as breast, bowel, lung and brain cancers, and how little that GPs actually know about gynecological cancers and the possible symptoms that could lead to them. Maureen, do you have anything to add?
Just to add that I'd never heard of it either. None of my friends or family had heard of it either. And I often think if I had known the symptoms and the risk factors, I would have been much more proactive with my GP.
Some further points to come out of the survey on early detection were almost all consumers did not know about endometrial cancer prior to their diagnosis. They were aware of the risk factors such as weight, smoking, and drinking from other cancers, but none directly about endometrial cancer. The timelines to consult a health professional about symptoms range from between 4 weeks to 12 months. Consumers are also hesitant to present to their GPs as pain from bleeding was commonly associated with period pain and has been tolerated. Diagnosis was often delayed with GPs reluctant to undergo tests or misdiagnosis for perimenopause or fibroids. Women also reported that their symptoms of bleeding were also attributed to menopausal bleeding.
When I got my diagnosis, I was told I was likely to need radiation following the surgery. After the surgery, I got my call with my results and yes, definitely need radiation. I was to get more details at my treatment planning appointment. When I got there, I was told, yes, 6 weeks of external radiation, and because they found a speck of cancer in a lymph node, they thought I should also do chemo, but wanted to see how I felt about it. Well, how did I feel? I felt shocked, as it was the first time it had been mentioned. Well, I went with the chemo as it was recommended in my case, and I had decided early on to do whatever was recommended as that was my best chance. The researchers found that the delivery of diagnosis of cancer needs to be communicated with more empathy. A few women were concerned about the delivery of a diagnosis with other patients in the room and only a room divider between them. Consumers also felt that they had no understanding of what it might mean for them and the next steps.
COVID, what an experience it was. It was horrendous, not just having to get a PCR test every time prior to a treatment or consult, having to wait in a long line of cars for 3 to 4 hours, and then the agonising wait to see if it was negative. Then the drive to the hospital, Port Arlington to Melbourne, for the treatment could range between 2 to 3 hours depending on the traffic conditions. And to top it all off, when we got to the hospital, it was like going to a prison. I would drop Diane off in the main foyer and give her a huge hug and kiss and try and console her before she'd have to go by herself and disappear through the doors with a suitcase in tow into the hospital, not accompanied by me for support. This was never more the case when she was to begin a 4.5-week stint of radiation and chemo, which was for her to be dropped off on a Monday and picked up on a Friday and come home for the weekend. But this was changed to a concurrent solid 4.5-week stay at the hospital, as they did not want to risk any chance of her getting COVID. And I or any family were not allowed to visit and comfort her. This was very stressful on her, and I could sense that her mental state was not well from our phone conversations, which is only means of communication. It was a really terrible time, and when I picked her up, I could see she was stressed out. Not a good place to be in after treatment and being isolated from family for that long a period of time. I have no doubt many others have experienced this. Here are some of the other points to come out of the survey. All but one consumer reported that their active treatment was timely and likely within the 4-week MDM target. All consumers underwent hysterectomy and most had radiotherapy, with a few having chemotherapy. About half the consumers also had HRT. Most consumers did not have to travel far, but a couple had to travel significant distances for treatment, especially for radiotherapy. 2 consumers reported that travel time was significant. One of these consumers reported that it could take them 2 hours every day to receive care between Geelong and Melbourne to receive radiotherapy. The negative impacts of COVID include traffic delays and the lack of a support person to attend the treatments. Most consumers were unaware or were not made aware of any clinical trials. One consumer had direct experience of a clinical trial. They noted that the trial nurses were excellent, caring and easy to contact. However, there were implications with the offboarding from the trial when they were no longer met the criteria. Fertility implications were also not discussed.
A friend of mine who had myeloma warned me about the void that happens at the end of treatment. After months and months of appointments, blood tests and treatments, there is a silence. You have a follow-up in 3 months coming up, but there's lots of stuff going on in your body as you recover from treatment. Nobody calls to check to see how you're going. Ronnie, did you get a call?
After the last treatment, until the next consultation 6 months later, we had no support other than me, no info on what to expect. There is silence, no follow-up calls. Diane became very withdrawn, not wanting to talk to anyone other than me. She was also very outgoing and talkative. When family and friends called, she would not want to engage. COVID did not help, and I think more needs to be done to follow patients' well-being.
You don't know what is normal and what is not. Do you bother to call the doctor or not? As the commenter on the slide says, thank goodness for the Facebook group. The researchers found that women reported complications from treatment. These included hernia, bowel functioning, and kidney stones. These complications were often not treated or took a significant amount of time to treat. Women with endometrial cancer also reported communication issues, results being too technical or medical, an inability to receive responses to questions and tests to be organised. Implications of taking different approaches in the clinical trial were not discussed. Difficulties in follow-up meetings for complications and recurrence diagnosis, and pathology results or treatment plans were not delivered to primary care from the specialists. Most consumers did not receive supportive care or psychological care.
Palliative care is something you don't think about, but when the time comes, there's a shock to the system. And this is not explained anywhere until the very end, so you don't get a chance to give it a thought and what it entails to prepare for it should it arise. It doesn't help with the mental side of things. Also, I didn't realise there is a distinction between palliative care, in that there is palliative care to help with recovery and palliative care for end of life. Maureen, do you have anything further to add?
My recurrence really shocked me. I had no symptoms and I felt doomed for sure. And every follow-up was like, is it back again? At about 2 years after the recurrence, one oncologist said to me, you are an unusual case, as we would have expected it to come back by now. I wasn't quite sure how to take that, as a positive or a negative, but in the end, I assumed it was a good thing.
Some more points to come out of the palliative survey were: consumers reported receiving written material via brochures, books or handouts. One consumer who received private care reported that they received very formative handouts but received nothing after their endometrial cancer diagnosis. Peter Mac and CCV resources were reported to be excellent alongside the nurse on-call service.
Consumers suggested more awareness of endometrial cancer symptoms. Every woman should know about the signs, symptoms and risk factors. Know the name, endometrial cancer. We will then be in a better position to advocate for ourselves.
Support patients seeking second opinions. Women have a second sense called women's intuition. It's very powerful. I know when something's not quite right with their body. So if they're not happy with their GP's diagnosis and ask for a second opinion or other test to be done, listen to them. Their body is telling them something is not right. It shouldn't be assumed that it is just hormonal or stress related. It could be more sinister and need further investigation. Improved GP education. I'm part of the ANSCOL group who organised the team of STS survivors teaching students, which consists of a coordinator and a team of volunteers consisting of gynecological cancer survivors and carers who regularly give presentations to student doctors and nurses throughout universities throughout the eastern states. A coordinator starts a presentation outlining how little is known about gynecological cancers and the statistics of how many women it affects, and it's rising rapidly. What symptoms to look out for when diagnosing a patient. This is followed by the volunteers giving their account of what they had to experience from being diagnosed to their journey through to treatment and follow-up. Improved communication and empathy. When addressing your patients with confronting news of their diagnosis, be sympathetic, put yourself in their position, and place yourself on the other side of the table facing yourself, and think about how you would like to receive the bad news. This is a huge moment. I know. I was sitting there next to my wife when she received the devastating news. I'll now pass over to Maureen for further comment.
Further recommendations include more timely screenings and diagnosis. Rather than saying that that's normal for menopause or you are too young for this cancer, some testing to rule in or out cancer would be most welcome. There also should be a process to manage complications, a clear contact person for consumers, and endometrial cancer coordinators. These three are all about communication and having a go-to person for continuity of care. Who should we call?
And finally, access to local care and access to supportive care.